Okay.
Yeah. We back.
Locked and loaded.
Hey, let's jump right into it.
Facts.
Welcome back to another episode of Cultivating Conversations with DP Squared. I'm your host, Deja, along with my wonderful co-host,
DeAndre Parker.
Yes, and we are back. Okay.
Right.
Thank you to everyone who is joining. Thank you to those who always join live, and to those who watch afterwards and catch up later when they have time. We appreciate all of it. So we love y'all. Appreciate y'all. Yes, health scare.
Facts.
Health scare. We're gonna get into that. But first, I just want to say, what's up, DeAndre? We back together.
First dual podcast back. Let's clap it up in the chat.
Let's make some noise, y'all.
Make some noise in the chat for that, man. First dual podcast back.
Oh my gosh. I'm excited.
Facts.
I'm really excited. Okay. But you know how we start off always.
Yes. Do we have a
lovely quote?
Indeed.
I would love, hey y'all. I would love to get a you know what, you already give me a number.
Let me think. Is there a number?
Or
what?
Okay, go ahead.
What's today's date?
The 21st.
All right, that's what I was 21.
That's what I was gonna say. All right, y'all. We're gonna choose. Okay. For those who don't know, we start the pod episode with a quote from this lovely book to just get us going.
Yeah,
see,
get the minds flowing.
Get the juices flowing. See
what the people talked about.
All right.
We got here today.
Let's see.
You're not supposed to read it before.
I don't really like any of this. Okay.
Just choose one.
What about this one? Do you know what this one might say? It says, before we set our hearts too much upon anything, let us examine how happy those are who already possess it. Does that make anything? Does that mean anything?
Let me see that.
Is it given like,
before we set our hearts too much upon anything, let's examine how happy those are who already possess it? I think that kind of makes sense.
Yeah, I don't know. It kind of makes sense, but I also don't know what direction it's going in.
Like, what do people think about that? I see it maybe focusing too much on extracurricular or like goals or objectives you fail to realize the people around you, like who already have your heart in a good place or something.
Maybe, I guess.
Yeah.
I mean, let us know what y'all think. Okay.
Yeah, what you think?
The way I read it was like, before we try to, no, actually, I kind of agree with you. Yeah. Now that I read it, I kind of agree with you. Okay. Well, we'll see. We might have to ditch this book because they don't be giving me what I need.
You don't think so?
I don't know. Not always. But it's cool. All right, y'all. So today's title is health scare.
Not between us.
Yeah, health scare. Yeah, yo, that's
probably joined the thing. I was like, health scare.
Yeah, I know. Health scare is crazy, but we titled it health scare instead of health care.
Yeah.
Because like I think both of us have different experiences right now when it comes to healthcare and like what it means, what our experience has been before, prior to now, and just talking a little bit about the overall situation and systems that are in place in the United States and what we feel about it and how we can just kind of like have a discussion and see how other people's experience has been.
Yeah. Definitely.
The reason, go ahead.
Especially just healthcare in the United States, me personally, compared to Deja, which I think would be a good thing to kind of rely on, is because I haven't had too much of what she probably experienced, so I can look at it, especially coming from a young person, especially doing a little research. I can come from that standpoint, where she can come from research plus like a personal type standpoint.
Yeah. So the reason why I think this came up is because for those who don't know, I'm 26.
Yeah.
I know I look 19, but I'm 26. And this is my first time being off of my parents' insurance.
That's
now,
tough.
For those who usually don't know, you stay on your parents' insurance until you're 26, I think like a month after your birthday or something like that. And so literally since October of 2023, I haven't had insurance. That's dental, medical, vision, all of that. So this is I've never experienced that. Like I've had friends and stuff who've been like, oh, I haven't been to the dentist in years because like I didn't have insurance growing up or something, but that has never been me. I've always went to the dentist twice a year, more than that. Always went to the doctor, always went and got my prescription. Only paid like $25 or something when I went to the doctor. Didn't have to pay full price because I had my parents' insurance. And now all of that is like gone.
That quick.
Gone. And my experience not having insurance have been horrible.
For real?
Because of the fact of like knowing that I can't just go to my normal doctors that I've that I like because they don't accept, they were accepting insurance I was on with my parents. So is that, and then my experience of having to go for the first time in my life to the like the Medicaid office, I guess, where you're trying to apply to get some sort of insurance for, just to have some sort of coverage to be able to go and get services if you need it at a lower price. And that was crazy too, like waiting hours in line. I missed the deadline, so even though I went, I still couldn't sign up. It just was a lot. So it made me realize, like, dang, all these years, things I didn't have to go through, and then now that's my reality, and it's just a weird feeling.
It's like kind of feeling a displacement.
I feel weird.
And so in the place you are now, I want to ask, like, you first, do you see the positive sides of having healthcare? One,
yes.
Well, not having it,
or having like health insurance. I guess
health insurance.
The upside, for sure. And then the importance of having like good insurance, because I know people have different type of like coverage. I know they're different types. I know everyone's isn't the best, but I was very blessed and appreciative that I had parents that had, like, I could go to good doctors. And so I definitely feel I took that for granted. And then what's crazy is I barely get sick. And then when I get off insurance, that's when I was like the most sick. And it's so, you feel helpless not being able to go. I had to go to the doctor on campus because that's all I could do.
That's
so
crazy.
Just,
so what do you think about the U.S. not having universal health care?
Now that I'm in the thick of it, I feel like it's crazy because, Auntie Dana, so someone asked, you don't have insurance through your job. Great question.
Do you?
No, because the job I have, like the role that I'm in, they offer you to get partial insurance, but I didn't want to pay for that because some employees get like full coverage, like the whole health package and benefits and stuff. But the role I have specifically doesn't come with that. Like that wasn't a part of my offer package. So I would have had to like do a different plan to pay extra or something. And I just didn't want to do that. I'm like, I'm already on my parents' insurance. I'm only going to be off their insurance for like 6 months before I try to get a new job. I could try to make it work. But I probably should have did something because now I don't have nothing. But so that's why the next job I do have, like that's one of my main questions, like what is the health benefits package so that I don't have to go through this again.
Okay, so
yeah. But what was your question?
I don't remember, but I want to relate it kind of to like logistics.
Okay.
And back to you, I want to ask you a few questions. So people within the healthcare society say that, the rise in prices, and we'll get into like your thoughts on the prices, right? About the insurance, because it kind of correlates. So they basically say like the introduction of new technology and new findings for procedures is some of the reasons for increase in,
how much it costs?
How much it costs, right?
Okay.
But it actually come to find out, even with all these new, tech and things, mortality rate in babies have increased. The average life expectancy has decreased.
Dang.
Obesity has gone up, plus diabetes, right?
Oh my Lord.
So it's like, even though there's new text will be coming out
to make it better.
Yeah. Do you see? Oh, Brandon asked the question.
Okay. Aren't you supposed to get insurance if you work full time? That's a great question too. I feel that some industries find loopholes in that because technically the role that I have, though I work 40 hours plus, technically the role is considered intern. So that I guess they can find loopholes by like naming it that to not offer me benefits. Because you have to pay someone a certain salary, I think, to have benefits. I think that's how it works or something like that. I don't know. I'm not really sure, but I know, especially in the sports industry, they find ways around that. Like my friends, like one of my friends works in like film and stuff, and they don't give people health insurance, and she works like 40 hours plus. So I don't know. I think there are ways companies know how to get around it. I'm not sure the specifics. I just know that's very common in like sports that there's a lot of positions that don't offer it. So
what I want to ask you, basically, all that being said, why do you think everything is rising in price?
Because I feel like health is another capitalistic like business. And please, I want people, if they disagree with me, please say.
Facts. I
feel that like
the conversation.
Health care is really like it mirrors sales a lot because you're trying to sell certain pills, certain pharmaceuticals. Like doctors literally can go to people who sell medicine can go to a doctor and like pitch their medicine.
Yeah.
And then like that's the medicine sometimes that a doctor can prescribe you, like when you get to the doctor, you know, so like certain pharmaceutical companies, whatever. So I just feel that like it's another business where they're just trying to.
Yeah.
I mean, and there are strides being made for certain research purposes. I do definitely agree with that. Like there are certain things you can see that have gotten better when it comes to health, like being able to cure people with certain things or be able to, I don't know, do like what's it called when you like can you do IVF? Like, you know, when someone can't physically get pregnant, but you can like take medication to. I'm just saying there's certain things, technologies that have come into place that has made things better, but that just hasn't been my experience.
So. Yeah, I think the high healthcare rates is strictly political. Okay. Because, and I want people to, you know, talk back to see if they have any disagreeing or agreeing stuff, but they know that if you need healthcare to survive in a way. You know, some people don't do it because they can't afford whatever, but the middle class average person who can't afford it will get it. So they can increase the price as much as they want.
Because you need it.
Because you need it. Because everything is funneled through that, right? But how I see it is the healthcare system not being universal, meaning that, you know, there's not a lot of government intervention and governments can't place a certain amount on what how things can be bought, used, or whatever. There's so many industries and companies that have a say in what can be produced and what can be bought and what can be used through the hospitals, which is just funneling more money for everyone.
And they don't want government's involvement.
They don't want government's involvement, and especially if governments were involved, it would decrease the amount of money that everybody else could make. So from their standpoint, why would we ask the government to help the people when we are going to be making less money?
When they make less money. Yeah, that's true.
So like the prices can just keep rising and rising because the people that are setting these prices are the people that's making the pharmaceuticals, you know?
For sure,
so it's like,
no, that's
it's like
true.
for the average person, especially being in a low income area, they're limited to healthy foods, one, because of like food disparities and stuff like that. Then they don't have enough money to get the healthcare, which leads to more deaths in that community. So it's just like it's
a cycle.
Yeah, it's like a cycle.
Okay, so what do you think about like people who don't? I don't know if you knew a lot about that, but I know how they had like Obamacare or like the Affordable
Healthcare
Care Act or something like that, where it did allow people to get affordable health insurance. But what do you say to people who don't want to use their tax dollars to or just on services that don't really impact them?
Right. So I can, from that standpoint, right, I'm gonna play the filmy, but like from that standpoint, what I'm seeing from the opposite side is like there's things that people, when they pay their tax on, like education or like housing or, you know, like economic development, and it's like, well, if I don't need this, you know, development, like people are very inclined to not view things unless they experience them.
I feel that's a human experience. That's a human response sometimes.
Right. And so it's only like I searched it. It's only 7.8% of Americans don't have health insurance.
Only who?
7.8%, and it's like 26 million people.
Okay.
So it's like, if you look at it from that standpoint, and the majority has healthcare, but most of the people, I mean, less people don't. It's like people are not going to want to fund that because they're seeing it from a different perspective. You know, so I mean, from my perspective.
So okay, and I want people to weigh on this. Say you make $1 million. Say your salary was $1 million, right?
Yeah.
Say they said you would have to give 30% of your salary to to participate in funding health insurance for other people. You already have your own insurance, mind you. Right. But you had to give up $30,000 of your income for that. And this is bad math because I don't know what the actual math would be. But I'm saying, what would you say to that?
Probably no. Right. Because like people are in tight situations now. You said $1 million, right?
If you made $1 million, but you got to give like 30%. Okay, so 30% of your income.
If you got $1 million income, but you live in $1 million lifestyle, that's basically it. You think it evens out to the point where it's like, well, that $1 million that you're making is not as much as me. You think that $1 million is, so 30% of my paycheck. I need that.
But see, that's the argument that people are making. They're like, I don't, and not just with health, but with other stuff. They're like, I don't want to give my salary.
I see that the only solution to this, personally, you cannot delegate.
If you have universal health care, where the money coming from?
That's true. I'm saying that you can't delegate. Hold on. Auntie Dan said, keep in mind, insurance is a big business, right? Even if you have insurance, your insurance company can deny a test, even if your doctor say you need a specific test. Oh, right.
Yeah. Like the insurance doesn't always cover everything. And that's what she's saying. Like, because a lot of times people pay insurance every month or something. Then when you need it, they're like, oh, no, we can't cover that. Or we only cover some of it. Or you see that all the time. Even with like car insurance, they don't always cover everything. Yeah.
Yeah, I was going to say, you can't delegate something for the people through the people. You have to make like an executive decision to say, this is going to happen, whatever. And then you got to take the backlash when it comes, because if you go through every person or every government or every industry, of course, most of them are going to say no, because they're thinking about themselves. You kind of have to, put that foot down if you're like at a government standpoint.
Yeah, you do.
Brandon said something too. My thing is, I get frustrated when I compare gross/net for my paychecks.
Yes.
But it's a safety net. If something happens to my job, I like that. And other people have something they can use.
Yeah. So what he's saying is like, you know what gross versus net pay is? So like your gross pay.
Yeah.
And
like your gross pay is what
this is Deja Dictionary, of course.
Gross pay is at like what you see, but then everything taken out.
And then like you get your gross pay is what you like should be making, but they done took out like a chunk of your paycheck to go to this taxes, this and this medic, so all these social security, whatever. So Brandon was just saying, though that's frustrating, at least like that money is going to, I guess, things that can benefit other people, or it could benefit yourself depending on like what it's taking out for like other, your it could be like retirement, whatever. They take out stuff. I don't know.
Yeah.
But yeah, it's tough because you can see that number at the top. You be
like take the good with the
I could be making so much more. Yeah. But have you ever been misdiagnosed? Like, have you ever been to the doctor and felt like a doctor didn't take what you were saying? And you can say no, because that would be a good different perspective. But have you ever been to the doctor and it's like you felt that somebody didn't give you the care that you needed based on like whatever?
So I've been to the doctor like officially. When I say officially, I mean like not checkups. Like I've probably been done like 4 times
outside of annual checkups. That's pretty good though.
Like majority of things that happened to me have not been harsh where I needed something like a drug or I needed a surgery or I needed something that was like life changing.
Yeah.
So from my perspective, no, I've never been misdiagnosed for I don't think anything. Like what the case may be. What about you though?
Yeah, and yeah, I definitely would like to know what other people have. I think that. Yeah, I have.
For real? And what? Well, you don't gotta say it.
Yeah, no, I'm trying to think. Because I know I have. Well, the only thing that comes to mind is when I was in my first year of college, I wasn't eating.
Oh, wow.
And I didn't know why. I'm just like, I'm not hungry. I'm just, I don't know. And so they had gave me like these acid reflux tablets, because if you know me, you know I don't take pills. So they gave me little tablets that I could chew on to help break up the gas in my stomach so that I could have an appetite. And it did help out. But then that they said that was the only issue. Like it was just I had gas in my stomach and like, I had to just it would subside. Yeah. But later on I found out that I was going through like depression.
Oh wow.
And I mean I wasn't diagnosed with, like, I wasn't clinically diagnosed, but after having conversations with other people, I realized like in other like perspectives, I realized that I was just like me being in a depressed state affected my appetite. But when I went to the doctor, they were just telling me like, no, it's just you just have gas in your stomach and like it'll that's the first, but it's happened to me many times. That's the first thing I could think of. So like I wonder, I know that happens to a lot of people where you learn, you be like, oh, I have this, like my head is hurting, something like that, and then you realize that it was something bigger than what it was.
Something more. And I think that comes down to the workers, the employees, whoever, the doctor, the nurse, or whoever actually attempting to care about their patients. Because of course, many times people they want the person just to be in and out. And actually, on that point too,
I definitely felt rushed too.
Oh wow.
When I've been at places,
yeah. And actually, a lot of the spending that the U.S. does on medical industries and hospitals is on the salaries of the workers.
Like paying their salaries. That actually happens in school, at colleges. Okay. Like at the college I used to work at, they were saying most of the tuition payments was going to pay for professors because it was a prestigious school, so they had to like fund their salaries.
So a lot of the payments that come to the hospitals are coming to the salaries of the workers. So it should be their profession to care about the patient that's coming in. And when it comes to misdiagnosis, I know that happens a lot.
It does.
And death can result in that too, depending on like negligence just from the person that you're speaking to. So I mean, when it comes to perspective for me, if I have to go into the office, I expect to be taken care of accordingly, and they should do anything that you ask them to do until there's no more to do.
And it's kind of sad because I was thankful that I had doctors that I could trust. So if they said something was going on, like I trusted their judgment. Not in college, but like my actual doctors. But it sucks when people like you think you could trust somebody, but they're giving you false information. That's why you should always go to like 2 people, or don't just, if they tell you like, oh, it's okay, be like, oh no, I'm gonna go to somebody else, or do like just don't just take the first thing someone tells you because Mike said she had bronchitis, but the doctor told her it was just a cold. Stuff like that. That you just got to be mindful of, or don't just take like you have a headache for 3 weeks straight. Like you should go figure out what's going on. Like don't just think stuff is gonna surpass, because they were for us at the end of the day. I love saying that.
I wanted to bring up something that I wanted to ask you. It still pertains to, especially this is healthcare right here for real. Just like the healthcare whole scene, right? So back to like misdiagnosed, and I think it kind of correlates to, it comes in with the drugs and pharmaceuticals, right? People being misdiagnosed or diagnosed but given pills that they don't need, and then hooked on drugs. That's what I want to ask you though, because it's prevalent now, especially like drug overdose in a whole bunch of cities that are very heavy populated, and some aren't, but whatever. I want to ask you though, like even if all these things are happening where it's like advocates for drug use, pharmaceuticals to stop and stuff. If you see who's profiting, I have a little thing right here. The second highest people profiting is Walmart on pharmaceuticals, Amazon and Apple. And then the number one actually is insurance companies, pharmaceuticals, and wholesalers. So I have a question for you. Do you think that healthcare plus drugs, pharmaceutical usage will ever come to a decreased stop? Because you see who's profiting though. The highest corporations are profiting.
No.
So do you see any decline? That's why I want to ask the people and you too.
I'm gonna say first off, I'm gonna say no, because like I think we got to be real with ourselves sometimes. That the country we live in is about the dollar. Like everything evolves around that. So if we're gonna say the top companies who probably have their hands in other things in the United States, whether it's like politics or funding stuff that we don't know they fund, that helps things like stay afloat. We don't know what they, who they're endorsing and stuff like that. They're never gonna like take away their power, essentially. So especially if healthcare, especially if the issues of healthcare is not affecting people they care about.
Right.
Like we're not talking about the majority. Well, maybe actually a lot of white people do like middle income, lower income. There are a lot of middle and lower income people, white people, who are negatively affected by the healthcare system. But I'm saying in the majority, that when you see the crazy numbers of people who are like dying from childbirth or like diabetes and these top like diseases, is not people that they care to make sure are doing well in life. Like that's not going to stop the train from moving. You know what I'm saying? So that's just my thought. That's what I feel.
Especially if the pharmaceutical industry is one of the highest earning industries, and especially let's say hypothetically, I don't know the real numbers, but it's backing a lot of these industries and companies, helping them stay afloat or giving them extra profit. They're going to keep feeding the streets with drugs. Like even if it's unintentional, it's intentionally still, they know what's going on behind the scenes.
Okay. What do you, this is a little, this is not controversial, but what do you think about organizations that say they're raising money for these health related things, whether it's like cancer research or like, I don't know. I mean, do you think, if you've been around since 1962 and you've been raising like 30, 50, $60 million and y'all ain't made no progress?
I can't strictly comment because I did no research on this. But
me neither. I just thought about this.
From a strict conspiracy standpoint. I feel like initially some people, especially if you probably look at the backings of these fundraising companies, it's probably somebody that already had a lot of money beforehand, and they sometimes use this fundraising backing as a way to make more profits, or they really just had the content in their heart. But I feel like now, majority of the time, especially when you see just like these big fundraising companies that still are like taking money from individuals that probably don't have a lot, it's like, bro,
that's crazy.
At that point, it just kind of seems money hungry, because it seems like
you should have enough to do something.
Like, I understand the donations help.
Yeah, for sure.
It's like y'all should just be considered an industry at this point. Y'all don't need to be a fundraising company.
Yeah, yeah, and that's not to say every company. Yeah. I just be thinking about that sometimes. I'm like, why is Red Cross asking for my money? Like, y'all should have enough by now.
They probably do be helping a lot of people, though.
They do. Yeah, that's just me being,
Yeah, it's just...
Especially because you hear the stories about them not using it for... We learned about one company in our class. It's called, like, Wounded Warrior Project. They work with, like, wounded veterans or something, but... one of the CEOs, whatever, from back in the day, he was using money on his own stuff.
I wouldn't be surprised.
Yeah, but that's just one example. But
you definitely see the money coming in and how fast it's probably coming in because people think that your cause is actually being used.
Or they were saying most of the money was going to like paying people's salaries. It wasn't.
Wow.
Yeah, like the
has nothing to do with the cause.
Yeah, but I don't know.
See, I don't want to talk down on something I don't really know about.
Yeah, for sure.
So one thing is that companies ask for donations, like Walmart said, to use customer donations as tax write-offs. So I can see that too, like facts. Using it for your own profit compared to actually using it for what you're saying. For. It's
so hard because like I try to be like this person where it's saying, oh, I would never. I really wouldn't do that, but I'm saying when you start making money,
right?
It's like your brain is like, I want more.
Your brain is probably it's a switch. Like
it's just like I want more. How do I finesse the system? Yeah. Not saying it's right, but I'm just trying to be honest about how the brain works. Like that's just how it works.
You get hungry for
more.
You
do like what's going,
Nah, I definitely do see why. I don't see why because
I don't see why. No,
but it's like when you look at a money hungry standpoint, it's like, oh yeah, you're trying to make as much dollars as you can.
Yeah, that's just how.
Everything's just set up.
Like and everything expensive is like, whatever.
Everything's set up like that.
Yeah,
it's odd. But
did you have? I have one. Well,
go ahead.
That's my last thing. You have something else you want
to? Any final thoughts? Let me see.
Yeah.
No, I don't really have any I have one final thought I want to say. It's just that.
Okay.
I want people to understand, especially healthcare system, is that we're probably not going to get universal healthcare because of the strict politics that come with it. I know people fight for it like constantly, but I just don't see it ever happening because if you look at it outside of like, they're not looking at it as you're like, a middle class citizen or upper middle class citizen or lower class citizen outside the Capitol fighting for these things.
Mm-hmm.
They're sitting in the top building somewhere looking at numbers saying, oh yeah, this industry getting all this money. Why in the world would we ever agree to go government?
Yeah.
So I just think that you have to look at it, just kind of, keep fighting for what you believe in. But sometimes you got to bite the bullet and you got to pay for that healthcare. That's all I'm going to say.
Yeah. My last thing I would say for like the hashtag Go Cultivate, which hashtag Go Cultivate is basically like the thing we do to say, this is the thing from the episode that we just want people to take. Not saying you got to do it, but it's just something that we want to like.
Yeah.
Encourage. The one thing I'll say for like my younger people is that, or maybe even people who's transitioning, but when you're looking for a job and you're on an interview, ask about the health benefits package. Like understand what they will offer to you when it comes from a medical, dental, vision standpoint, because those are things you're going to need in life, and the jobs to help provide that for you. And then like you can go from there and maybe ask somebody you trust, like, is this a good package? Is this something that I could work with? Is this insurance good? Are they going to are the doctors I want going to take this insurance? Just stuff like that, because you might be so excited to get the job, but you didn't think about like all the other stuff that comes with it. And they should be able to give that to you if they are, a pretty decent place to work. So I just want people to think about that, because that's the place that I'm in now. Something that I didn't always think about. So I just want to make sure people know that.
Now if y'all tune into the recording, y'all seen what Deja was talking about, what she's going through now. So definitely something that could be important. Do I have a Go Cultivate? Tell somebody today that you love them. That's all I gotta say. Leave out that. I think Deja covered it all.
Yeah.
Sure.
Yeah, but I think that's all we want to chat about today. We're glad that we're back. We appreciate everybody who's always patient with our schedules, because things just be happening, and we try to adjust and do the best we can. But that is it for today. Thank you.
My bad. Anything upcoming though for us?
Anything upcoming? We need to be more consistent when it comes to dropping content on our social media pages, YouTube, stuff like that. So, and I always say, if anybody wants to be a guest or talk about a certain topic, let me know. No more Miss Tuesdays. That's what Kiana said. He always says that, right? But
for that, man.
No more Miss Tuesdays. That's the hashtag. Sorry.
No more Miss Tuesdays.
Yeah, but thanks everybody for joining another episode of Cultivating Conversations with DP Squared. Oh, the best podcast in all of Washington D.C.
Don't forget it, man.
But
hopefully y'all learned something today too.
Yeah, hopefully. So we'll see y'all next week.
Thanks for joining.
We love y'all. We appreciate y'all.
We'll see y'all, man. Peace out. Peace out. Peace out.